Mobile Integrated Healthcare is housed under the Oklahoma City Fire Department and was created to expand how we serve our community. MIH provides alternatives to traditional emergency resources by making sure that when individuals are calling 911, they are able to get the absolute best and correct response.
It's critical for Oklahoma City to have an alternative response team. We know that when people in mental health distress get connected to care, our communities are able to function more fluidly.
Our mobile integrated healthcare team has 4 units. We have crisis call diversion. That team is housed within the 911 comm center.
And so we are able to get those calls from the 911 call takers as they're coming in.
We're able to sit and talk with a person and really listen and get them connected to resources in the community.
Our crisis call diversion team can dispatch out one of our mobile teams to go out and actually meet the resident where they're at.
So our second team is crisis response team, that also is known as CRT. Our crisis response team is comprised of a paramedic and a mental health professional. So when someone calls into 911 and they're saying, I'm struggling with thoughts of suicide, or my loved one has been struggling, those teams are able to go out and serve where there may be a threat towards their safety or someone else's safety.
Mobile Integrated Healthcare's crisis response teams lessen the workload for police officers. This takes calls for service off the board, allowing officers to focus on calls that are criminal in nature and not mental health.
One of our other teams is called the Alternative Response Team, or also known as ART. They go on the lower priority mental health calls where individuals are calling in and really just needing some support in the community. The Alternative Response Team, that team serves also as our overdose response team. Since we have a paramedic, we're able to start some treatment right in the field, eliminating a lot of barriers that people may experience in starting substance use treatment.
We have the benefit of having some peer support members on our team that are really able to really be relatable to that person and offer hope and guidance in that recovery process. We also do follow-ups with the people that we interact with, trying to close the loop on those resources that we give them.
Our other team is called our CAP team, or our Community Advocacy Program. Our CAP program really focuses on individuals and creating capacity for those individuals to get their needs met on their own. Now, when they come across a similar problem, they now have the capability to think and problem solve for themselves and say, okay, where can we go from here? Oh, I remember CAP told me about this resource. And so then they're not needing to rely so heavily on 911 emergency services.
Everyone can be impacted by mental health or a substance use issue, whether it's themselves that are struggling or they have a family member or loved one.
We're able to really help individuals who are experiencing mental health symptoms get that specialized care that they absolutely need in order to make sure that police can maintain doing the important police work that the city relies on them, fire can continue to do their work, and IMSA as well. Having MIH come on scene really helps round out the services that are available to the residents of Oklahoma City.